Good morning. Good morning and welcome to the Marietta College Physician Assistant Program White Coat Ceremony for the class of 2022. My name is Miranda Collins. I'm the program director for the PA program, and to start off I would like to introduce the provost of Marietta College, Dr. Janet Bland. And the president of the Marietta College, Dr. William Rood, who would like to say a few words.
Thanks, Miranda. For those of you, I found a new use for the I-cord. I know, like your mittens when you were a kid, you don't lose your mask if you got one of these, right? Good morning, everybody. First of all, congratulations. Congratulations, congratulations. I even see we have a young one that wanted his white coat. So we got a future PA out there in the midst. This is a number of firsts. PA program should be very proud. Jan and I were talking. We got into discussions last March and April when the state was shut down that we wanted to bring the PA program back in person first. And as you might imagine, some of the folks on the other end of the telephone line had the shorter answer of no. But we said, hey, it's a great program, they got great protocol, they know what they're doing, they're in the medical profession, let's go. And fortunately, they said yes. Although they did say it was my call. I always like that. Can we do that? Well, it's up to you. Now we come forward and you guys are kind of the first in-person celebration that we're doing as we end this semester with the white coat ceremony and the upcoming two commencements. Both of our commencements this year are in person in this facility. And you say, Bill, both? Well, we're graduating the class of 2021 on Saturday, May 1st, and then we promised the class of 2020 we'd graduate them, so we're graduating them on Sunday, May the 2nd. So we didn't feel that a virtual graduation was enough. We felt that we're going to graduate them. Also a shout out to the PA program. I know the faculty know this, but the general medical community of the Washington and Wood County area knows who the PA program is, and they know who you are as medical professionals, and compliment me every time I see them on terms of recognized commodity out there. Quick story, hopefully put a smile on your face, although I can't see you all, that I read an article in the paper the other day and it said, who would have thought that I could put a mask on and go to the bank and ask for money? And worse yet, they gave it to me and I wasn't in trouble. You can tell that story for a long time. The medical profession has really stepped up during this pandemic. We can't say enough about our PA program. We can't say enough about you as students. Moms, dads, sisters, brothers, grandmothers, grandfathers, whomever, uncles, aunts. Thank you for joining us to celebrate this very important milestone in a physician's assistant student's career. We wish we could have had more spaces for you. We know this is being live streamed, so hopefully those people that are watching are smiling as well. And need to know that we at Marietta College are very, very proud of the success of the PA program and will continue to be proud of this success as it goes on in the future. So thanks, Miranda, thanks faculty, thanks PA students, thanks family. We're very pleased to have you here this morning. Take care.
Okay, continuing with introductions, I am going to ask all the faculty and staff of the PA program to come to the stage, please. How they all file in. This group of dedicated and talented people are the reason our program is so successful under normal circumstances. But the challenges that they have faced over this past year has elevated them to superstar status, in my opinion, and I think the students will agree. So I just want to bring them up here. I'm going to introduce them all one by one to recognize them for all of their hard work and the dedication they bring to the program every single day. So, this is Mr. David Sams. He is one of our faculty members. Dr. Kevin Alton, also a PA faculty member. Dr. Stephen Polton, faculty member. Mr. Brad Pierce, faculty member. Ms. Teresa Proctor, she's our assistant clinical coordinator. Ms. Penny Rose, she is our clinical coordinator. Ms. Donna Venom, she's our administrative assistant. Ms. Beth Bacos, she is a faculty member. Dr. Lynn Bostrom, she is also a PA faculty member. Dr. John Grissel, faculty member. And Dr. Steve Howell is our medical director. So, thank you all. You really are the reason the program is so successful. I also want to acknowledge the class of 2022. In general, PA school is tough. It is a tremendous amount of information that's delivered at a breakneck pace that a lot of people compare to trying to get a drink from a fire hose. Let's add in a global pandemic to this already stressful environment, and to most people they would think this is impossible. But to this group, they have been nothing short of amazing throughout this last 10 months. They have endured these lovely things every day. We've temperature checks, we've got symptom trackers, we've been in quarantine, we've become very familiar with Zoom. They've had separate classrooms, they've had lovely plastic barriers, they've been asked to help with inoculation clinics, we've done vaccination clinics since the beginning of the year. They haven't been able to do a lot of things that we normally do that are fun things. We haven't been able to have potlucks that we normally do. They haven't been able to participate in the callback days with the second year students. And then, they weren't even in the same classroom with each other or instructors until this semester. So despite all of that, they have worked hard, they have studied long, and they have rolled with all of the decisions and the changes that we've had to implement, and without complaint. I don't know that anybody has even come to my office one time to complain, which, to be honest, is amazing. So I want to say thank you to the class. Thank you for choosing and trusting us with your education during an especially difficult year. And despite all of the extra challenges, you all have shown up every day, eager to learn and ready to do whatever is asked of you. And we are all just proud of each and every one of you. And it's your zest for knowledge that drives us, and it's your determination to succeed despite any obstacles that's been inspirational. So thank you to the class. So today is a very special day. It marks a day of transition. The transition of being a student to a professional. Receiving your white coat is an important step on your journey to becoming certified physician assistants. Now a little history about the white coat. Originally, lab coats were beige in color. Thank goodness that changed when hospitals adopted the color white as a symbol of healing, cleanliness, and hope. Physicians began wearing white coats around the turn of the 20th century. For them, the white coat symbolized professionalism, purity of intent, and seriousness of purpose. Although white coats have been around for more than 100 years, the white coat ceremony is quite young. It originated in the early 1990s at Columbia University's College of Physicians and Surgeons in New York. Since that time, numerous healthcare schools have adopted this special tradition, including Marietta College, for which this is our 19th event. It is now my pleasure to introduce our guest of honor. Dr. Michael Sarap received his undergraduate degree from Kenyon College in Gambier, Ohio, and his medical degree from the University of Cincinnati College of Medicine. He completed his surgical residency at Marshall University in Huntington, West Virginia, and he is a fellow of the American College of Surgeons. Dr. Sarap and his wife Cindy will be celebrating their 40th, correct? Wedding anniversary, congratulations, in June, and they are the proud parents of 2 children, Michael and Andrea, and 2 grandsons, ages 4 and 7. Dr. Sarap's daughter, Andrea, followed in her father's medical footsteps when she graduated from our PA program in 2010. Dr. Sarap has been a general surgical, vascular, and trauma surgeon at Southeastern Ohio Regional Medical Center in Cambridge, Ohio since 1987, and at Coshocton Memorial Hospital since 2014. At Southeastern Ohio Regional Medical Center, he has held multiple titles, including Chief of Staff and Chairman of the Department of Surgery, as well as Chairman of Breast Care and Colorectal Cancer teams. During his career, Dr. Sarap has received numerous awards, some of which included Teaching Resident of the Year twice, Top 8 Young Physicians in Ohio, awarded by the Ohio State Medical Association, Distinguished Service Award, awarded by the American College of Surgeons, the Ohio chapter, and 5 awards from the American Cancer Society, including Volunteer of the Year, the President's Award, and the Excellence in Mission Award 3 times. Additionally, he has made numerous speaking engagements and has over 30 publications. I'm proud to say 3 of which were collaborations with our PA students, and one of those PA students was his daughter, Andrea. Despite his extremely busy career, Dr. Sarap has always found time to give back to his community. He has served 25 years on the board of directors for the Hospice of Guernsey County and 14 years on the board of directors for the Guernsey County Board of Developmental Disabilities. And if that isn't enough, he also shares his time, talent, and knowledge with medical learners from Lake Erie College of Medicine, from the Wright State University Boonshoft School of Medicine, and with Marietta College Physician Assistant Program. As a clinical preceptor for us, Dr. Sarap has been a guest lecturer and a clinical preceptor since 2006. So over the past 15 years, this may shock you as well, Dr. Sarap has precepted and helped to train 44 of our PA students, and counting. I think he's got some scheduled in the future soon. And he takes them for their 5-week general surgery rotations. And next week, he agreed to be on a panel, a webinar panel, hosted by the Ohio Association of PA Physician Assistants to talk about clinical year success and networking for PA students in Ohio. So he is the consummate medical provider and just an all-around amazing person. So we are so thankful for him. And without further delay, I would like to introduce Dr. Michael Sarap.
Thank you so much for that very nice introduction. So to the faculty, staff, graduates, current students, parents, grandparents, thank you for the honor and the privilege of participating in your white coat ceremony. Truly a stepstone to becoming clinical professionals and beginning your professional careers. To those who may not know, I've had the privilege of mentoring medical students, PA students, surgical residents for over 3 decades. My daughter, as she just said, graduated from this program. It was one of the best decisions of her entire life. She's been very successful, very satisfied in her profession as a result of the knowledge and skills attained during her time here for these skilled professionals and teachers. I would hope that the long string of students that we've hosted over the many years have come away from our time together with a better understanding of surgical illnesses and their treatment, but perhaps more importantly, had some fun and learned a little bit about how to care for patients, their families, and their communities with intellect, skill, kindness, and compassion. Hopefully, they've also began to understand the dynamics of healthcare delivery in a rural community as opposed to the big city. I'd like to briefly touch on 3 concepts during my remarks today in hopes that you will firstly avoid falling into a very common bad habit of developing biases toward patients, and secondly, that you will embrace the beneficial concepts of self-reflection and of living a life of meaning as they relate to your profession. I've always felt strongly that I have benefited from the interaction with students as much or even more so than the students themselves. Medicine is a profession in the midst of many changes, some good, some bad, and regulations and oversight of healthcare providers by the government, insurers, and multiple other regulatory bodies has resulted in many of us spending much less of our time directly caring for our patients and much more time pecking at computer keyboards, filling out forms, dealing with insurance pre-certification barriers. In many offices, computer screens physically separate patients from their caregivers so that the appropriate boxes can be checked to assure that the provider gets paid for their services. Lately, due to the coronavirus pandemic, the patients and providers are not even in the same room together. As a physician dinosaur, and I say that proudly, I truly value the art of listening and hands-on care. It is my belief that patient care is suffering from these practices, and hopefully we'll be able to turn this around, and you will turn this around in the coming years. These obstacles and barriers oftentimes drain our enthusiasm for our profession, and they chip away at our empathy and compassion. We can easily fall into the trap of prematurely judging or stereotyping patients to quickly plug them into a treatment plan without really listening and hearing what they are truly saying. The scientific term for this common professional malady is called cognitive bias. I urge each of you to read a little bit about this condition so as not to fall into this trap when you begin to practice, or even as quickly as your clinical rotations. For me, the presence of all you incredibly intelligent, enthusiastic, open-minded, compassionate, and caring students acts as a safeguard against taking the easy and faster and oftentimes incorrect approach with patients, and really to take the time to listen to them. It becomes very hard to prejudge patients with a student looking up to us to do the right thing and expecting us to treat every single patient as though they were a member of your family. I truly thank all prior and future students for keeping us honest and continually relighting the flame that drove us all to a healthcare profession. The concept of emotional intelligence is not new, but is incredibly valuable that I urge you all to become familiar with its tenets and to utilize them every day to make yourself a better person. It's a tragedy that many incredibly intelligent individuals fail in their jobs and in their lives because of their own lack of self-reflection and an inability to understand their own emotions and the consequences of their actions. We see this in the medical profession frequently. Basically, emotional intelligence involves building an ever greater ability to read and understand our own emotions, being then able to control them and our actions, also understanding the effects of our emotion and actions on those around us, and finally, being able to use these skills to become a leader to effect positive change in our lives and for those around us. Emotional intelligence, or EQ as it's mentioned, is a much more accurate predictor than is IQ, or basic intelligence, in terms of success in life, and these skills can be learned. I'd urge you to read about this. I also asked you to consider the concept of happiness. Seems like such a simple idea. Everyone perhaps has a different idea about happiness and what it takes for each of us to reach that state of being truly happy. I encourage you each to dig into this subject a little, and I guarantee the extra work will pay real dividends. One thing is for sure, that research has proven that attaining more and more wealth and more stuff only goes so far in making you content. So a simple equation sometimes can be used to define happiness. That equation is that happiness equals your perceptions of the events of your life minus your expectations of how life should behave. The better your perception, your attitude, your perspective on what is happening in the moment, in the now, and the less you worry about what your expectations are, the happier you'll become in your life. Several traits and actions increase one's chance of finding happiness in their profession and in their life. That vision. You also have to engage in the practice of gratitude. People talk about 3 good things, whether it's every evening or every week or at least every month. Sit down and write down 3 good things that have happened to you in your life, and you'll become more grateful for things around you. It also means being selective about relationships. It also means understanding the difference between happiness, which is in the individual moment, the now, versus contentment, which is this lifelong pursuit of one's purpose in life and attaining their best self, being the best that you can be. Some individuals spend their entire lives in the pursuit of so-called true happiness and finding the meaning of life. Viktor Frankl, a Holocaust survivor, wrote that true happiness is attained not by finding the meaning of life, but rather by living a life of meaning. A meaningful life is accomplished by caring for others and participating in worthy deeds, causes, and activities. True happiness in your life and your profession will then ensue. It will enter your life via these meaningful activities. A profession in healthcare is about as near a perfect setup to engage in lifelong, meaningful work that I can think of. So, it's White Coat Day. When you wear that white coat, you suddenly find yourselves in positions of power and authority, and people will seek you out for help, advice, and leadership positions. I urge you all to look for areas of true need in your communities and participate in things and activities that are bigger than yourself. Invest in the youth of your communities. Become a public health educator. Participate in community health care screenings and community coalitions. Be involved and active in your professional organization, whether that's on a local, a state, or a national level. The more involved you are, the increased sphere of influence you have to make the world a better place. So I'm asking, actually pleading, that each of you strive to leave the world a better place than when you arrived. I would wish for each of you to find a place, a position, a philosophy in your lives that leads you to jump out of bed each and every morning and look forward to going to work. This concept of reason for getting out of bed every day, or reason for living, is beautifully described by the Japanese term ikigai. Ikigai depicts the individual in the center of a Venn diagram of intersecting circles. These circles include having a vocation or a position in life in which you're doing something for which you have a true passion. You get up every day and you love what you do. Doing something that you believe you can do better than anyone else in the world, or at least pretty darn well. Doing something for which you are well compensated. That could be financially, emotionally, it could be many things. And then lastly, doing something the world really needs. It's something that you're fulfilling a mission and you're helping people. As you don that white coat today, I also ask you to turn yourself into a giant sponge. Soak in every single moment and detail of your clinical rotations. Even if at times it seems boring, uninteresting, or unrelated to your future path, you just cannot learn everything out of a book or from Dr. Google. Much of the art of the medical profession still depends upon teachers and mentors passing along pearls to their students. Sometimes this happens even without the exchange of the spoken word, just by watching and listening. The white coat you put on today is also a magical ticket into the lives of others, into a world like no other. It is truly a gift and an honor to be allowed to become an intimate part of sometimes the most tragic, sometimes the happiest moments in the lives of our patients and their families. Births, deaths, trauma codes, miraculous saves, exploding gallbladders, terrible cancers, acute MIs, emotional crises, and every other imaginable and some unimaginable situations await you. So I would tell you to turn off the TV, turn off YouTube, and get ready for the real-life versions. I urge you to intently watch, listen, and feel what is happening around you. Even better, go home and write down a few lines in a journal each evening, something I truly regret not doing over the last 4 decades of my life in medicine. It's amazing what we go through, and we forget much of it as we go. So thank you, best of luck. You've all been very well prepared for this next step in your education. I would wish that you go make the best of it. I think the future of healthcare is in very good hands. So thank you all very much.
Thank you, Dr. Sarah. Penny and Teresa, get ready. Everybody's going to want to do a rotation with him next year. Coming up soon. Next in our program is the awarding of the Dr. Gloria Stewart Scholarship. In 2018, I had the honor to present the first Dr. Gloria Stewart Scholarship. And as our founding director, this award was created in recognition of her illustrious career and her zealous dedication to the PA profession. The criteria for the scholarship were established with knowledge of her values and included preference for students that were non-traditional students, first generation college or first generation healthcare providers, students who were responsible for dependents, and or students who were from economically disadvantaged backgrounds and or communities. So in addition to those criteria, the scholarship committee decided to award this scholarship to a second-year student who during their didactic phase or their first phase displayed a professional demeanor with an outgoing and positive attitude, also with professional interactions amongst the faculty and the staff and other students, and just had an overall team-based mindset shown by their willingness to help others and participate in MC Pass, which is our student society, or program events or events within the local community. So it is my pleasure to announce this year's Dr. Gloria Stewart Scholarship recipient as Julianne Matusik. She unfortunately had a prior engagement, so she's unable to be here with us. She does know she received this scholarship, and we will send her certificate to her. So congratulations to Julianne. Okay, at this time I'd like to invite the faculty and staff back to the stage for awarding of the white coats. Students, you may go ahead and line up as well, and we will have you all come forward as Mr. Pierce reads your name.
Say your name if you come to the stage. Max Alsbach. Abby Ashbaugh. Allison Biedenharn. Michelle Borchers. Samantha Brown. Lauren Kuntz. Hannah Cawthorn. Shannon Doyle. Hannah Dugan. Jack Ellis. Alexandria Fabian. Margaret Filiomeni. Bailey Philbin. Jade Gamp. Chelsea Haynes. Jacob Hearn. Matthew Kessler. Catherine Kistner. Leanna Lehner. Kimberly Lovejoy. Kristen McCausland. Jared McMillan. Victoria Raydell. Lydia Richards. Austin Rust. Mallory Schmidt. Sydney Smith. David Stamper. Shelby Stockton. Mackenzie Vogt. Madeline Vossen. Reagan Walters. Javelin Weaver. Timothy Weeks. And Jessica Yurkovich.
Congratulations to all of you. Let's give them all a big round of applause. Now I'm going to ask all of the class of 2022 to stand and face the center of the room as they recite the oath, the PA oath together. I pledge to perform the following duties with honesty and dedication. Thank you. I now invite Dr. John Grissel to the podium for Howell's Helpful and Hilarious Pearls.
Good morning. Class of 2022, it is my honor to address you at your white coat ceremony. This started last year with Dr. Howe presenting to the class of 2021, and at that time at the end, he had a little golf ball, which I have up here, and he gave it to one of the students, and that student gave that golf ball to me, and that's why I'm up here now. So at the end of this, I'll be picking one of your names out of a hat. You'll come up and give the golf ball to the next person who's going to be speaking at next year's white coat ceremony. I have a couple of stories from my training. The first story I have is when I was a resident at the Cleveland Clinic, a radiology resident at the Cleveland Clinic, and I was on the fluoroscopy rotation when we do upper GIs and barium enemas and all sorts of barium type of procedures. And we were getting a new clinician, a new attending physician coming in from Duke. And his reputation preceded him. He was supposed to be a person who was very hard on the residents. And the residents at Duke did not have a lot of great things to say about him, other than he was very smart and he was a good teacher, but he didn't treat the residents as well as they had hoped. So of course, his first day is a Monday. He's doing fluoro. I'm the only resident on fluoro that day, so I'm gonna have to meet him and introduce him to the Cleveland Clinic. The way we did it at the time was from 8 to 9, the residents were in conference, and the attendings were supposed to cover the residents and do the cases, and then start the day when the residents come at 9, or go on with the day when the residents come at 9. I get a page at 8:15 from Cindy, who is the lead tech, and Cindy goes, "Dr. Baker's not here. We can't find him anywhere. We went to his office, we paged him, we can't find him. We got patients waiting, do you mind coming back and starting the day?" I said, "Sure, that's fine, I'll come back." So I go to the first room and I do the esophagram. I come out, Dr. Baker's still not there. I go to the second room and I do a barium enema, and that takes a little bit longer. And I come out, Dr. Baker's still not there. So I go into the third room and I do an upper GI, and I come out and there's this gentleman in scrubs that I've never met before, and he's got his arms crossed and he does not look happy. He looks angry. And I'm like, I haven't even met him and I've already messed up. I've already irritated them. And I kind of ignore his demeanor, and I go up to him with my hand out, to shake his hand. "Hello, Dr. Baker, I'm John Grossell. I'm one of the residents." And he completely ignores my hand. He comes up and gets right in my face, and he's like 2 inches from my nose and goes, "DSU." Turned around and walked away. And actually, that's not exactly what he said. I'm making this more appropriate for the audience here, but DSU. And he goes away and he starts doing cases on his side of the fluoro suite, and I kind of finished my day. And at the end of the day, it's about 2:30, 3 o'clock. We're done with all the fluoro cases. We're going over the cases, and he's teaching me in an unfriendly manner, but still teaching. And we're going through the cases. He told me how he wants me to dictate the reports for him to sign later. And he goes through the whole thing, and he never says what DSU means. So he gets up and is starting to walk away, and I go, "What does DSU mean, Dr. Baker? You never told me." He turns around and says, "Don't screw up," and walked away. And I guess that's kind of the minimal advice to give somebody is don't screw up. And before I started here, I would think that wouldn't be maybe necessary to say, but unfortunately during my time here, we've had students screw up in rotations and actually going onward. So I guess in the minimal advice is don't screw up, and that's from Dr. Baker. I kind of like to put a little bit more of a positive spin on it, and I say, I think you should do the right thing. What I've found in life is that most of the time, the right thing to do is obvious. You know what the right thing to do is. When you don't want to do it, it's because it's hard, it's inconvenient, or you don't have the time for it. But what I'm telling you is you should do the right thing. We're teaching you what the right things are to do. When a 65-year-old male comes in with iron deficiency anemia, and you know one of the most common causes of that is going to be colon cancer, you do a digital rectal exam and you look for guaiac positive stool and you look for rectal cancer. So 9 months later, they're not seeing Dr. Sarah and finally getting the diagnosis. You make the diagnosis now, right? So, I would say do the right thing. Whenever you can, whether it's inconvenient, whether it's hard, you know what the right thing to do is. If you don't know what the right thing to do is, ask your supervising physician. You have someone to collaborate with. All right. My next story is from when I was a medical student at Ohio State, and I was doing a trauma surge rotation at Grant. And the first senior resident was actually the first PA I ever met. Dr. Doug Paul was a PA for several years, started his family, and wanted to actually be the surgeon. He wanted to be the man, so he went back to med school, was a surgery resident in Dayton, and was doing a trauma surge elective rotation at Grant. One of the things I remember about Dr. Paul was when we were on call, we'd be in between cases or waiting for something to come in, and we would sit in a recycling room, and if we would take the pull tabs off of cans of soda and put them in a gallon jug of milk, and if we filled it, he could take it to the recycling center and get like $50 or $60 to support the family. He's making $30,000 a year as a surgery resident. He has 3 kids at home. And what he would do if we would help him is teach. It'd be 3 o'clock in the morning, we're in between cases, we're taking pop tabs off, and he's teaching us about Crohn's disease, splenic lacerations, colon cancer, whatever the topic that came up, and was doing teaching. And I would encourage you to take advantage of all those learning opportunities. Take advantage of taking call with your preceptors. A lot of times it's a little bit more laid back, there's more teaching that can go on, and I would encourage you to do that. So during my time on that rotation, Dr. Paul left, and we had a new resident come in. And that new resident was from Louisiana, and he was a self-proclaimed Cajun from Louisiana. And this is in probably the early or late 1980s or early 1990s, and he had this habit of dipping during rounds, and so he would put a little bit of smokeless tobacco between the cheek and gum. And he had his cup with him, and so we would talk outside the room about the patient. We would, fill him in on what happened overnight and how things were going. He'd spit in the cup. He would put it on the handrail between the cup and the wall and kind of, have it be there in a kind of precarious position. We would go into the room. He would talk to the patient. We knew we would never be in the room for more than 5 minutes because he had a spit. We would come out of the room, and he would, get his cup, spit in the cup, and then we would summarize what's going on with the patient and then what the next steps for the day were going to be. And in these, in these groups, you have a team, and it's often the 2 or 3 medical students, a couple interns, a couple junior residents, a senior resident that's kind of running the thing, the pharmacist, social worker, other people in the team. And so one time we came out of a room and he asked a question, and I knew the answer to the question, but it wasn't my patient. And the way you do it, the unwritten rules are, you let the intern, medical student, resident whose patient that is answer first. And if they don't know the answer, then it goes from junior resident, intern, medical student, and let those people answer in that order. So I was waiting, it seemed like forever. I was waiting forever. And finally, no one answered, no one knew the answer, so I blurted out the answer. And he turns around, and he comes up to me, and he goes, "Son," and he spits in the cup, and he's like right in my face, like some of the spit came back onto my face. I could smell the tobacco juice. He goes, "Son, you're an epididymis." I have been called many things in my life, but I have never been called an epididymis before. I don't even know how to take it. He spits again, and he goes, "Son, you're an epididymis. You are on the ball. It's an anatomy joke. And I was kind of happy that it was actually kind of a positive thing. So my last thing is to be an epididymis as you go on into your rotations and go further. All right. I have a couple other things I'd like to do while you gave me the podium. First, I want to thank Dr. Sarah. Miranda gave him a wonderful introduction, and it was all good information. I would like to add to that, actually. First, I'd like to add, when he comes for his didactic lectures, it's one of my favorite days of the year because he brings Kennedy donuts. He brings like boxes and boxes of Kennedy's donuts. So I know that I'm going to have a sugar rush in the afternoon. But he has precepted 44 of our students. But what's even nicer is when we're in a bind and we need a surgery preceptor, we always call Dr. Sarah, and he always says, yes, I will take that student for a week, I'll take that student for a month, I'll do whatever you need. And that is, you never find that anymore. And we appreciate that, and thank you very much, Dr. Sarah. I want to acknowledge a couple people who are going to be doing their last formal white coat ceremony today. First, I'd like to talk about Penny Rose. When the program started in 2001, 2002, Dr. Stewart came from South Dakota to start the program. Her first hire was probably the best hire. It was Penny as the administrative assistant. Penny has been literally with the program since the beginning. And the amount of experience she's gained is tremendous. She was administrative assistant for several years with Gloria, and then when the clinical coordinator position came open, she was willing to fill that role. And I think everyone would agree that of all the roles that are in the PA program, that is the most difficult role, especially during a pandemic when most programs, or when most health centers are stopping letting you bring students in. We're trying to place students in multiple different places, and we have to get creative in how we do that. And, Penny's just been done a tremendous job all the time. She's professional. She's the best proofreader of any important email going out. When I was trying to figure out how many white coat ceremonies they've been a part of, I asked Penny, and she told me this is the 19th white coat ceremony. So Penny's just been tremendous, and we're going to miss her tremendously. And I'm glad I'm neighbors with her so I can keep on seeing her in the neighborhood, but we're going to miss you in the PA program. The other person is Mrs. Collins. Miranda Collins is our program director and is going to be leaving us this May. We are very sad that she's leaving. She has been a tremendous program director. She also came right at the beginning. I think Penny was the first hire, and then Miranda was the second hire as clinical coordinator. And she was clinical coordinator for several years, and at that time, being a PA, she actually set up not only all the rotations, but she also set up all of the syllabi, all of the interrotation exams, and basically all of the learning that was going on in the clinical year was in Mrs. Collins's purview, and she did a tremendous job with that. In 2008, she wanted to transition into a full-time faculty member. And so that's when Penny took over clinical coordinator. Miranda came in and was now a faculty member with us for several years. And when Dr. Stewart retired, I think it was 2013, we had trouble finding someone to replace her right away. So we had to have an interim program director, and Miranda stepped up and became interim program director. And the thought at the time was, from my standpoint, because I didn't want to be interim program director, was Miranda had been clinical coordinator and had been faculty. She knows the program as well as anybody. And so she stepped up in the interim program director role. She did that for a year. And I would say from my standpoint as the chair of the search committee, people that we brought in weren't going to be as good as Miranda. And Miranda was kind enough to take on the role full time. And knowing that we had an accreditation survey coming up in 2017, And the accreditation survey was more than any of us could have imagined. They had kind of changed how they were evaluating programs. The 3 Ohio programs that had been had a survey done before ours was coming up, all 3 of them were put on probation. And knowing that, put a lot of stress on us, and a lot of late nights and early mornings, a lot of tears, a lot of angst went into it. But by the time they came in September, Miranda was ready, and we were ready. And not only did we pass, but we got the longest accreditation period of 10 years. And so we didn't have to go through another one for another 10 years, and it was a tremendous accomplishment and something that we're all proud of in the PA program, and it was under her leadership that happened. So we appreciate it. We're going to miss you. Best of luck to you, Greg, and Lucy, and
Don't be ashamed. Come back to you.
Chelsea Haynes. Chelsea.
Thank you very much. And congratulations, Dr. Alton. Our last speaker of the day is Mr. Cameron Flora. He is the Marietta College PA Student Society president from the class of 2021, so the upperclassmen. So he is going to share some words of wisdom for you all.
Good morning, everyone. As Ms. Collins said, my name is Cameron, and I'm from the class of 2021, so currently going through my clinicals right now, and looking to graduate in the next couple months. So through this speech, I hope to just offer you some advice about when you're on your clinical year, and hopefully some helpful tips and ease a little bit of anxiety that you might have. So I remember my white coat ceremony, trying to remember which arm goes first and trying not to trip on the way up. And you all did great, so especially the one with the cast. That was very impressive. So good job with that. But I don't think when I was in your shoes last year, I really appreciated the significance of this day. This really is a great responsibility, getting your white coat. When people see you in your clinicals, there's going to be a lot that is expected of you, and it's a great privilege that the preceptors that you have, they're going to be allowing you to see their patients and participate in the care of these patients. And so at some point during this day, I encourage you to reflect on this and just remember some of these emotions you have today, because over the clinical year, it's not all going to be sunshine and rainbows, and I think it's important to reflect on why you're here and just remember some of these positive emotions to get you through some of those harder times. Not only with this white coat are you representing Marietta College with the emblem on your shoulder, not only are you representing PAs in the PA program, but you're representing the world of medicine. And so with that, again, is just a great responsibility. So do your best each and every day, and just study hard for that. Also with the white coat, you're no longer going to be practicing your physical exam on each other, or maybe family members, or if you were really creative, maybe your dogs and cats at home. What were once suturing pig feet, you're now going to be suturing real humans after joint replacements, people in the emergency room. So my point is, you're going to have real people with real lives and real problems at the other end of your stethoscopes. So I think it's important to remember that and utilize that. These people are going to be more real to you than any paragraph that you can read from a textbook. So use this to your advantage. I remember on my internal medicine rotation, there was a patient who had a disease that I wasn't real familiar with called Charcot-Marie-Tooth. And he was very well read on his disease, and he taught me a lot about it just because I was willing to listen and ask him about it. And through that experience, I'll never forget the braces he had on his legs from the atrophy of his muscles. And so I think it's important to allow these people to manifest these disease processes to you and use that to your advantage. And they will become ingrained in your brain. But this coat is very symbolic. It signifies a crossroad. You have all done so much to get to this point through your undergraduate degrees and whatever healthcare experience you had when you applied here. Possibly the most significant crossroad of your career so far. Again, you've just come such a long way, and this faculty has done an excellent job giving you the tools that you need to succeed. And at this point, you have most of the tools that you're going to need for your clinical year. But the journey is not done. So at this point in your career, when you go out into your clinicals and are seeing patients, is the point where you're going to start organizing these tools in your tool belt. And this is the point where you really get to refine your technique. So my point being, there's still much left to learn, but still difficult road ahead. With this white coat, that's why the white coat is short. Eventually when you graduate and you go into your prospective careers, you will get a longer coat when your journey is completed. There's going to be days on your rotations where you feel like you can't get anything right, and your preceptors may seem like they're just picking on you or asking you questions that are hard, and you may feel like it's unfair. It'll save you a lot of anxiety if you use this as fuel instead of being paralyzed by anxiety. There's really two reasons that I see why preceptors might do this and ask you hard questions. The first of which being that the healthcare field is difficult. And in the healthcare field, it's important to have thick skin. There's going to be many situations where you're put through challenging experiences, and I think it's important to use this to improve your mental fortitude. And ultimately, it'll prepare you for when you're on your own and you don't have somebody looking out for you. The other reason that I think many of the questions you get will be challenging is to push you. I can say for myself that over the clinical year, I've learned way more from the questions that I got wrong than the questions that I got right. There's something about fear and fear of failure that will push you to become better. So I encourage you to, instead of being anxious about these experiences, to use them and embrace them. When you have a day where you feel like you missed all the questions, to use that night to really study hard and come back the next day an expert, and you'll be all the better for it. And you are all a resilient group. You wouldn't be sitting here today if you weren't. So just utilize this and continue to grow that throughout your clinical year. And also, it's okay to feel like you don't know much. I did my first rotation in family medicine at New Carlisle, And the preceptor that I was with takes PA students from UD as well. And they're on a little bit of a different schedule than us with Marietta. They graduate and start their clinicals in December. So when I started my first rotation, they were already close to being done with their clinical year, and it felt like they were steps ahead of me, and a lot of times they were answering questions that I felt like I didn't know, and it was a little bit discouraging, to be honest. But the past couple months, I did my second family medicine rotation there, and I was the more experienced ones with UD students who had just started out their clinical year. And it was really encouraging to me to see the contrast, how I was able to now help them through a little bit, and I could kind of see the gap a little bit where I knew a little bit more than them, and was able to help them out. So my point being with that, just keep grinding each and every day, even if it feels like you aren't progressing. Just sleep well at night knowing that you are. There's a quote that I like that I think really manifests this point. Don't look at the mountain in the distance, or else you will trip over the molehill in front of you. So just keep working hard. Eventually you'll get to a point where you'll be able to look back when you're on top of that mountain, and you'll be able to see how far you've grown. And I'd just like to again congratulate you all, and good luck.
Thank you, Cam. Yep. Students, as I mentioned before, you now have transitioned from a student to a healthcare worker. With receiving your white coat, you also receive its historical symbols of healing, hope, and professionalism. This obligates you to acquire all of the expectations, the responsibilities, the commitments that live in its pockets. Although you still have much to learn about medicine and patient care, and you're short, as Cam mentioned, White Coat will announce this to others. Soon you will be working with real patients. Patients who, when they see you in your white coat, will see a healthcare provider. They will trust you with personal information, and they will expect you to be competent, professional, and compassionate. They will expect you to remain current with the science and technological aspects of medicine, and without forgetting the importance of compassion, empathy, patience, and the power of the human touch. So thank you all, congratulations, and thank you for being part of this important ceremony for the class of 2022. So I'm going to have the class go ahead and stand again so we can give them one last round of applause. This concludes our program. I am going to ask the students to go ahead and go out. We're going to take a picture.